It's a few times. All right, so hi everyone, my name is Valentina and I'm here on behalf of Community Language Cooperative, and I'm here to provide and guarantee your commitment to language justice. Language justice is a type of simultaneous interpretation that seeks to create spaces in which no one language is dominant, spaces in which everyone can participate with the language of their heart. So to achieve this objective, we will be using Zoom's interpretation feature. And in a couple of minutes, what you will see is that a new little button that looks like a globe will appear at the bottom bar of your screen, on that same bar where you have the mic, the video, the chat, and all of those other buttons. It'll be towards your right hand. When you see that little globe, go ahead and click on it and select either English or Spanish as both the language that you will be listening into and speaking into. If you're joining the meeting on a phone or on a tablet, you will find the same options by clicking on the button with the 3 little dots on the lower right-hand corner of your screen. Hola a todos, a todas y a todos. Mi nombre es Valentina y estoy aquí por parte de Community Language Cooperative y estoy aquí para ofrecerles y garantizar su compromiso con la justicia del lenguaje. La justicia del lenguaje es un tipo de interpretación simultánea que busca crear espacios en los que no domine ningún idioma, espacios en los que todos puedan participar con el idioma de su corazón. Para lograr este objetivo vamos a utilizar la función de interpretación de Zoom y lo que verán en un par de minutitos es que aparecerá un nuevo botón que parece un globo terráqueo en la barra inferior de su pantalla, en la barra donde está el botón del micrófono, del video, del chat, etc. Va a estar hacia su mano derecha. Cuando vean este botoncito que parece un globo terráqueo, hagan clic en él y seleccionen inglés o español como el idioma en el que van a estar escuchando y participando. Si usted está en esta reunión por medio de un teléfono o de una tableta, encontrará las mismas opciones haciendo clic en el botón que tiene 3 puntitos en la esquina inferior derecha de su pantalla que dice More o Más. A quick reminder for those of you that do prefer to use English for this session, Spanish is 20 to 25% longer than English, so please be aware of your speed and of your clarity. And everyone, please do remember to mute yourselves if you're not participating to avoid that any background noise that we might all be experiencing interferes with the interpretation. If you have any questions or any issues with the technology, please let the whole group know by means of the chat box so that we can work together to address it. Un breve recordatorio, la interpretación es simultánea, entonces por favor cuando participe recuerde mantener un ritmo como de conversación para que yo pueda comunicar su mensaje completo en el otro idioma. Si tiene alguna pregunta o algún problema con esta tecnología, por favor comuníquese al grupo completo a través del chat. Listo, vamos a activar los canales y asegurarnos de que esto funcionen bien. Muchas gracias por tenerme por acá. Okay, let's go ahead and turn the channels on. Thanks again for having me here.
Cool, I think we're good. Should I run through the agenda or are you gonna take that on me? Sorry.
It's on you. Feel free to run through the agenda, Clara.
Okay. Cool. Well, welcome everybody. Thank you so much, Valentina, for getting us started with interpretation. Thank you all so much for being here today. We will, as the title of this webinar suggests, be focusing mainly on the process of how to enroll in the Colorado option and OmniSalud, the new program that is kicking off next month. So it's coming up very soon. So we hope this will be a useful opportunity to learn a little bit more about the logistics of how this will work and how it will benefit the immigrant community. So we'll be starting off with some introductions of our different organizations that are involved in this webinar. Run through some vocabulary, some different terms that we'll be using throughout the webinar. And then we'll be talking in a little bit more detail about what is the Colorado option and what is OmniSalud. After that, we will do kind of a demo to show how the process will work, and then finally go through some eligibility questions.
Thank you, Clara. And hi, my name is Miriam Guadalupe Ordóñez Rodriguez. My pronouns are she, her, ella. And to begin, I wanted to introduce you guys to CCHI. For all of those that don't know who CCHI is, we are the Colorado Consumer Health Initiative, which is a statewide nonpartisan nonprofit And what we really concentrate is on making sure that everyone in our state, regardless of documentation status or anything else, really has access to high quality and equitable healthcare. And what equitable healthcare means to us is, as we all know, if you cannot afford something, you cannot actually have access to it. And so what we do a lot is we advocate for policy change for healthcare at the state level. We do some of that at the federal level, but we concentrate on state. And we also have a consumer assistance program. We do a lot of organizing and grassroots, as well as education, which this is part of that work. And we also build alliances with different orgs across the state. And this is how we're connected to CIRC. And we want to thank them for working with us. And I'll pass it over to them.
Thanks so much, Miriam. So I'm here. My name is Clara. I'm the West Lobe Regional Organizer and Healthcare Campaign Manager at CIRC, and I'm here representing the Colorado Immigrant Rights Coalition. We are also equally excited to be working on implementing and sharing out all this information with CCHI and Connect for Health. So CIRC is a statewide membership-based coalition made up of several different organizations with the broad goal of trying to improve the lives of immigrants and refugees in Colorado. We believe in the inherent dignity and human rights of every person, and we don't believe that immigration status should have anything to do with people's access to just work, housing, and healthcare. So some of the work that we do, this is definitely not a comprehensive list, but we advocate for changes to state law. We also work to educate the general public around issues related to immigration. Sorry for that typo. And we work to expand the collaboration between organizations that support the immigrant community. And I believe now I'm passing it over to Jesselyn.
Hi, everybody. My name is Jesselyn Hampton. I am the Public Affairs Manager at Connect for Health Colorado. We are the state's official health insurance marketplace. So traditionally, Coloradans who don't get health insurance through their job or through the government can come to us to purchase a health insurance plan. We are the only place that folks can get financial help to lower those health insurance costs. We offer free, expert, virtual, and in-person help all across the state. And we provide the platform for people to compare those health insurance plans from multiple health insurance companies. We have not been able to serve Coloradans without documentation or DACA recipients until now. That changes November 1st, and that is what we are here to talk about. And thank you to CCHI and CIRC for hosting this event and for all of their help getting this really important program off the ground.
Thank you, Jesselyn. So now we're going to go into vocabulary. One thing that we have noticed throughout all these webinars and presentations, as well as communication with just the community, is we need to make sure that we're on the same page as to what each term means and how it's connected to the OmniSalud and Colorado option, which are going to be available starting November 1st for enrollment. And I'll let Jesselyn, if you want to actually explain these terms, and I'll take the other ones.
Sure. So as Connect for Health Colorado, in order to serve our Coloradans without documentation, we know that data privacy is very important. So we created a separate marketplace called Colorado Connect, which will be the shopping platform for those health insurance plans. And then the program that we are all here to talk about today is OmniSalud, which is what offers insurance coverage to Coloradans without documentation and DACA recipients.
Yes, thank you. And a big thing that I'll also add to the OmniSalud program is that this is incredibly important. Before this, as Jesselyn stated once again, Connect for Health wasn't able to actually sell health insurance to people that were undocumented, while also not able to offer them what's really important and also part of why we're celebrating, which are going to be the Silver Enhanced Savings. And Jesselyn, please add anything that I'm missing. The Silver Enhanced Savings is the name of a state subsidy. This is a financial assistance, which is very huge because now Connect for Health can sell to undocumented humans, but also and DACA recipients, but they can also offer financial assistance for undocumented folks as well that qualify under the 150 federal poverty level, which is $1,699 monthly for an individual who are undocumented. And so what's also pretty cool is if they qualify for the Silver Enhanced Savings, the Colorado option plans will be 0 monthly premium and low out-of-pocket cost. And so that's really important. Another addition to this, or the other vocabulary word that's really important for us tonight, is the Colorado option. The Colorado option is an insurance plan. And so the Colorado option is a new standardized insurance plan that will be available to folks both in Connect for Health, so those with documentation, as well as for those that are undocumented through Colorado Connect and OmniSalud. Something that's important, and another reason that we're talking about the Colorado option, is that the Colorado option is a standardized plan that will be sharing. It will have the same benefits and cost sharing in each metal level, which ideally is going to make comparing plans easier for folks, and it will provide a higher value plan. And a big thing that's really important is this year, the only plan that's available for those who are undocumented to purchase through OmniSalud and Colorado Connect is going to be the Colorado option. And anything I missed, Jesselyn, before I move to the next slide? Thank you. Just want to make sure. And so here is a little QR code, and I'll also drop this link in the chat. This is something that is available for all of you to have. It's a little resource that explains what each health insurance term means. And so you can also scan it with your phones if you're able to. But this is a very quick guide, because something we know and understand is that a lot of the folks that are going to be moving towards the Colorado option this year who are undocumented or on DACA may not have had experience with insurance before. And so I'll also plug in that next week on the 27th, we're doing a healthcare coverage 101, where we're going to be going over these terms again and how insurance works. So understanding the Colorado option. So most benefits are going to be covered with no additional copays. And something that we believe is really important is primary care. And what is a copay? Before I get too excited, is the set amount usually paid for a healthcare visit. So a copay, it should be a small amount. It really ranges how much you're going to pay based on the service that you are receiving. Something that happens with ACA regulated healthcare plans is that most copays for preventive care, most preventive care visits don't have copays. And so with regards to the Colorado option, for primary care, behavioral, and mental health office visits, as well as prenatal health care, you can go to these visits for an unlimited amount of visits without having to pay a copay at the beginning. And so that's really important, because we believe that without that copay, it will open up the ability for more folks to get the care that they need. And it really does depend, because I want to give an amount as to what a copay normally looks like, but it's hard to gauge based on the insurance plan and the service that's being provided. And so to restate, what's important about the Colorado option is that there's clear services that will not have a copay. And now we go into the deductible, and all of this is pretty exciting. So I don't know what you guys are doing with the excitement that these terms are, but once again, you guys have a guide where you can look at it. It's both in Spanish and English. And so what is a deductible? It's the amount you pay before your health insurance covers more of the cost. And so with the Colorado option, it would be $100 for individual and $200 for a family. I mean, $200, yeah, for a family, which is what's important with insurance and what's important with understanding these terms and how they're going to work with the Colorado option plan is that you can predict and budget for what these services are going to look like. And then out-of-pocket maximum is the total amount you pay for accessing healthcare services in a year before your plan covers 100% of the cost. And so this breaks it down again with the Colorado option. For an individual, it would be $1,000 and $2,000 for a family. And right, if we can please stay on mute, please and thank you. At this point, I have a question in the chat, which I can answer now. This will not do backdates on services, sadly, but a thing that does exist that can do back services depending the time that it has been since the service offered would be emergency Medicaid for those that are undocumented and on DACA. And so from here, we move on into more terms. And these are some of the benefits covered with the Colorado option instead of coinsurance. So coinsurance is a percent you pay for a healthcare service once you've met your deductible. And once again, we can go back to the deductible. The deductible is the amount you pay before your insurance begins to cover. So individually, it would be $100 and $200 for the family. But as we said, copays are easier to plan for because it helps you predict since it is a set cost, whereas coinsurance can vary. And so another thing and another benefit of the Colorado option is that we expect and hope that all prescription drugs in the Colorado option would use copays. And once again, a copay is a set amount that you pay to receive a service. So for example, with me, there's certain appointments that would be $60 or $40 for my deductible. But as I mentioned, the Colorado option has more services for preventative care that don't have a copay that needs to be paid for it. And so with this, I think I have another question, and then I'll just answer it and then push it to you, Clara. So prenatal and postnatal is covered in Colorado Connect with OmniSalud. So I'm just gonna adjust the vocabulary when I reply to this. So prenatal and postnatal is covered through the Colorado option. And the Colorado option can be purchased through Colorado Connect through the program, which is OmniSalud. But it will be covering prenatal and post. Thank you, and I'll pass it over to you, Clara.
Awesome, thank you. So I'm just going to talk briefly about why this matters, particularly for the immigrant community. And I think Miriam will be chiming in with any points that I may have missed, but some of these we touched on already. But as many of us know, historically, immigrant communities have had a lot of barriers and holes in opportunities and like services and opportunities that are accessible to most people. So this will, play a role in patching up one of those holes that exists in services for immigrants. As an example, immigrants often don't have access to preventive medical care and therefore are forced to wait oftentimes until an emergency to seek help. So we want to try to minimize that dependency on emergency Medicaid, and hopefully this will create an opportunity for immigrants to be able to seek medical care proactively, which has, both physical but also mental health benefits. As we've already discussed through the OmniSalud marketplace, undocumented immigrants can now have an avenue to enroll into private healthcare insurance, which previously was not possible. So that's really exciting. And the subsidies that we touched on before, the Silver Enhanced Savings, make it even more accessible to certain individuals and families that will qualify for those subsidies.
Sorry, I keep muting myself and can't find the unmute button. Yeah, I think I just wanted to once again touch upon what Clara said. It's very important, and the reason why CCHI, along with CIRC and other organizations, worked so hard to pass the Colorado option is because we truly believe that this can help our undocumented population, particularly, receive the healthcare that I don't think they're just that they need, but the healthcare that, in my opinion, they're entitled to. As the working force in Colorado and across the United States, we are usually pushing and forcing our undocumented communities to ration healthcare. And as we know, healthcare, particularly in the United States, is one of the leading causes to bankruptcy as well as medical debt. And so we believe that by getting them insured, we're offering a coverage of not just for their well-being, but of dignity. And so we really appreciate all of you guys being here to learn a little bit more about what this means and what it can lead to your and what it means for your community and family. I also did want to add that I am bilingual. We are bilingual. So if you guys have any questions that you want to put in the chat, and if you speak Spanish, we will be able to answer them for you as well. Thank you. Now to Jesselyn.
So again, the reason why it's so important that we get our friends and neighbors enrolled in health insurance through OmniSalud is simply health insurance helps you access important physical and mental health services, and it protects you from medical debt. With this plan, folks can have access to routine medical care at $0 oftentimes, and even more specialized services that are low cost. It also provides predictable prescription drug costs for those much needed medications. The out-of-pocket costs for long-term conditions or chronic conditions are limited. And folks can still use emergency Medicaid for life and limb-threatening emergencies while being enrolled in OmniSalud. Oh, let's find the OmniSalud slide. I don't know how it got out of order. There we go. So what is OmniSalud? We keep talking about this. So this is the program that allows Coloradans without documentation and DACA recipients to shop and compare for insurance plans on Colorado Connect with or without Silver Enhanced Savings. So what is Silver Enhanced Savings? Those are that financial help that is available for those Colorado option plans for Coloradans without documentation of a certain income. All right, so that's the financial help. That's a huge piece. Health insurance can be really expensive. So if we go to the next slide, these are the incomes that will qualify for those $0 monthly premiums. So customers have to be under 150% of the federal poverty level, but what that means in terms of actual money, you see here on the screen. So for a single individual, that's an annual income of a little over $20,000 a year. For a family of 4, it's going to be a little over $40,000 a year for that household income. So folks who live in Colorado, who are undocumented or DACA recipients and are within these income ranges will be able to enroll in this plan for $0 a month, and 94% of those medical expenses are covered by the insurance plan. So some frequently asked questions. You do not need an ID to apply. There will be no ID verification, but I want to make really clear that the name you give on the application should be consistent with the name that maybe you would use to apply for a Colorado driver's license or that you receive on a utility bill. We want to make sure that's consistent so that when folks enroll and actually go to use their coverage at the doctor's office doesn't see a discrepancy and accidentally turn people away. Coloradans do not need pay stubs or other forms of proof to prove their income. It is all self-attested. Customers enroll through our platform, Colorado Connect, but we really want to encourage everybody to use one of our experts. We call them brokers and assisters. We have a webpage for you that we'll talk through a little bit more with experts who can help in a variety of different languages, who will walk people through the application step by step, answer all of their questions, and also help folks understand how to use that health insurance plan, right? How to find a doctor, how to get their prescription filled, and what all of those terms that Miriam just ran through actually mean, right? In terms of being able to see a doctor, it's going to work just like any other private health insurance plan. They will need to find a doctor within the network of that plan. And again, the person who's helping this a customer enroll will be able to help explain how to find a doctor with that new health insurance plan. And then the two big ones, can my information be used for immigration enforcement? No, absolutely not. We are required by law to keep your information secure, and we take that very, very seriously. And finally, will I become a public charge if I enroll in OmniSalud? And the answer is no. Enrolling in OmniSalud with or without the financial help will not affect your ability to gain citizenship or residency. And if we could zoom out a little bit on the screen, it got a little wonky on our end, Miriam. Thank you. Perfect. And we'll go to the next slide. So when, right? This is all very exciting and it's coming up soon. So folks will need to enroll between November 1st and January 15th to be covered for 2023. So if you come in, you enroll November 1st, all of the coverage starts January 1st, 2023. So I want to make that clear. If you enroll November 1st, it won't start November 2nd. This is all for the year 2023. So it's really important that we're getting out this message and driving as many folks as possible to take a look at this program so that they can enroll between November 1st and January 15th. And then we will, in just a minute, go into an actual demonstration of the application. But I just want to make clear that the information needed to enroll in this program is a name. Again, it should hopefully be consistent with the name somebody would use to apply for a Colorado driver's license, a Colorado address, birth date. An email address is required so that you can have an account associated with your plan. You will need information on your income. That includes wages, tips, any other type of regular income. Again, however the person wants to count it is whatever they choose, right? It's self-attested. And then household size so that we can determine that income eligibility. And with that, let's turn it over to Jeff Miller to introduce himself and walk us through the application.
Yeah, so if I could take over the screen, that would be lovely. I think it says, all right, there we go. Give me one quick second here. All right. So first and foremost, my name is Jeff Miller. I am the user experience implementation consultant at Connect for Health Colorado. What that basically means is I help do user research and any design consulting for our product development teams, who built all of this out, are currently heads down, tying everything up and making sure we are ready to go November 1st. So what you are seeing here is what's called a prototype. What this means is these are all design mock-ups connected via a design software. So I won't be typing into certain input fields or anything like that. I will mainly be clicking from screen to screen just to give you all a sneak peek of what this application will look like. One very big thing is I cannot zoom in any further on the screen I am sharing. So I know Zoom has options at the very top of the screen where you can zoom in further if you cannot view the information you want to see within my screen. So that's a little tip if you want to dive in a little further from what you can't visually see within the application. One very last thing I do want to call out before actually giving the sneak peek is this is all in English for year one. I just want to reiterate that if that wasn't announced yet. The teams are working on it for next year to make sure it's all in Spanish, but that's the last thing I do want to call out before diving into the application. All right. So this is the sign-in page. You can see it is branded as Connect for Health Colorado. That is on purpose. I will show you all where the branding will change and how it changes based on the application. So with this page, we are going to first and foremost create a new account. And this is what's called the Let Us Guide You page. Connect for Health Colorado has this as well as Colorado Connect, excuse me. I'm going to click on Help Me Understand What I Qualify For. And here is some information you provide to give an estimate of what route you should take if it's Connect for Health Colorado or Colorado Connect. I'm not going to go through line by line this the Let Us Guide You, but some typical questions are anyone in your household applying for coverage 64 or older, anyone under 26 or formerly in foster care, and some other additional questions here. You will also be able to provide the people in your household if anyone is 19 or under, and if anyone is pregnant within your household as well. Here you can provide an estimated income. You can provide it via monthly, annually, biweekly, whatever it may be. You have all those options in this drop down here. But within this prototype, I'm not actually able to click that drop down. All right, so here are the next steps. This is a super important page because it provides some very good information on what route you should take. Some of the new language we provided here is this important note. So important if you don't qualify for Health First Colorado or CHIP because of your immigration status. You may qualify for health plans using the Apply for a Health Plan button below. And then the additional options here of what this outlines is to apply for private health insurance plan, continue to Connect for Health Colorado. Individuals who do not have a lawfully present immigration status can qualify for health insurance plans through our partner, Colorado Connect. And so with that, and with everything outlined here, I'm going to apply for a health plan. And this is the Create Your Account page. The biggest thing I want to call out here is the My Information Sharing options. This outlines how your data will not be shared in any way when you select Colorado Connect. I'll read these actually verbatim just so everyone gets a clear understanding. So for the Connect for Health Colorado option, the verbiage is I want to share my information with Colorado's official Affordable Care Act marketplace. I agree to the Connect for Health Colorado terms of use and privacy policy. And then the Colorado Connect one is, I want to share my information with Colorado Connect. a partner of Connect for Health Colorado that provides coverage options for people who are undocumented, and then you agree to the terms of use and privacy policy. If that is unclear to the applicants, they can click this help drawer that provides additional information to clarify what Connect for Health Colorado is and what Colorado Connect is. I'm not going to read this because it's very heavy in text. But I do want to call out before I move on, we are pushing for these individuals to use brokers and assisters. So this, if they do try to apply by themselves, they think they have the confidence to, we do try to push them throughout the application to get help because some of this terminology might be confusing to them. Very last thing on this page is you are only able to select one of these options for the My Information Sharing options, either Connect for Health Colorado or Colorado Connect. And what you decide here will take you down two different paths, either Connect for Health or Colorado Connect. So you can see we selected Colorado Connect option here for the My Information Sharing options. We're going to click Submit. It takes us back to the sign-in page where you can still see it as Connect for Health Colorado branded. But once you sign in via your email or username and your password, that will then take you to the new Colorado Connect application. This is a completely redesigned welcome page compared to Connect for Health Colorado. So the current options we have for year one is obviously applying for 2023. You also have your My Profile information and application results. We won't have any application results yet because we haven't applied, but I do want to quickly just show the My Profile page here to show what information you will be able to see and change if you ever wanted to as an applicant. All right. So with that, let's dive in to applying for 2023. So here is what I called out a little earlier is we are pushing for these individuals to use brokers and assisters. So if they forgot to do that and they try to apply themselves, this is the very first page that they get to when they try to apply for 2023. And we have all of the options for the brokers and assisters here. So first and foremost, the brokers, you can have a broker actually call you. All you have to do is fill in this information here, just typical first name, last name, contact method, phone number, so on and so forth. And a broker will actually reach out to you to discuss health insurance. The next option is find a broker, where if they wanted to actually search themselves some broker options, you can search by city, state, and zip code, as well as if you actually already know broker name or agency or license number, you can provide that information as well. We'll go ahead and search for a broker, and it just gives you all the options via your search criteria. This is all dummy data. It's all fake, so take it with a grain of salt what you're looking at the screen. But then you can go ahead and authorize a broker as well going through this process. I also want to show the functionality of removing a broker just to show that historical data and what that will look like. So I clicked remove. You just go ahead and click OK on removing that broker. And then you have those historical records to see who you have previously used in the past to help you enroll in health insurance. We also have assister options as well. So the authorized assister organization, if you do have the assister organization site ID, you can provide it here. All you do is click authorize and it's successful. It's as easy as that with authorizing an assister organization. You can also find an assister. Go into here. And it takes you to this find an assister widget where you can provide your zip code, the search within a certain number of miles. And what's super valuable here is you can filter by languages as well. So if they want only Spanish speaking, you can select that and they'll be able to search assisters via that way. When you click search, it will outline all of the assisters available. And you would be able to schedule an appointment as well via this assister widget and process here. This is my little shortcut button. This is not actually within the application. It just gets me back to the application for us to move along. And with all of that, I am going to actually just enroll on my own to show the rest of the application. All right. One thing I do want to call out with this application, this is one of the most streamlined applications that we have created. It's way quicker than Connect for Health Colorado. That is on purpose based on user research we've done, and everything that we've researched is trying to make this as a smooth and seamless process as possible. So the Tell Us About Yourself page is, we're only asking for first name, middle name is optional, last name, suffix, date of birth, sex, and if you are applying for health insurance. We're going to save and continue, and then we dive right into your address information. So we ask around your residential address and your mailing address. And then the very final question on this screen is if you are a Colorado resident. I actually believe that language has been updated to are you currently living in Colorado, to make it more straightforward for everyone going through this application. They just haven't provided me the updated mockup, but I did want to try to call that out here. All right, and we are already into the income pages. So one thing I want to call out here is we are not asking any information around what company they work for, anything like that. It's just, do you have a job? What is your total income? And include the commissions and tips if you have earned those. Is the income self-employment income or part of seasonal commission or tip-based work? And does your income change during the year or from year to year? So try to keep it as minimal as possible on the type of income questions we ask. We do ask around additional income sources and deductions, which is on the next page. These are all the same options as Connect for Health Colorado, basically copy and paste it over to Colorado Connect on the options we provide here as additional income sources. But some of these might not ever be checked. Some of them might be checked a lot, but we wanted to provide that whole plethora of options here on additional income sources. And same thing with deductions. I'll just reiterate that these are the same options as Connect for Health Colorado on anything that you would be able to deduct by. Going to save and continue. And this is our income summary screen. You can see all of the income, additional income resources, and then the deductions as well, which adds up to your total annual income. If you do disagree with that estimated income we provided here, you do have the option on this last question here is based on the income information you've provided so far. We've calculated your annual income as listed above. Do you expect your income to be different than the amount we calculated above for 2022? And if you selected yes, then you would be able to provide the income you thought you have earned in that previous year. Ooh, it's hard to think about the future year and the past year. Going to save and continue to the family overview page. This is where you will see every single person you have added to your application. We've only added one, so I am going to very, very quickly add another family member. When you add another family member, it's basically all the same screens as we just went through with the Tell Us About Yourself. So I'm not going to go through any of these pages with detail, but the Tell Us About Yourself, the address information here, and if you are a Colorado resident, same income screens with the same income questions, the additional income sources, the deductions, the summary of your income, and then the save and continue where you can now see that additional person added to the family overview. You would be able to edit, update, add additional family members, remove family members if you messed up. All of that functionality will be there November 1st. It's just now within this prototype that I'm sharing with you all right now. All right, so click Save and Continue, and here is the declarations and signature page. A lot of verbiage here. I'm not going to go through it because this isn't even accurate information. This is all just dummy text here. But all you do is need to electronically sign here to continue to shop. All right. So this is the application summary and what you qualify for page. The team that is currently working on this page hasn't gotten me the finalized language. I know it is finalized. They are just very busy to get this ready to roll November 1st. So I haven't gotten in touch with them around the updated language here. But this gives you a nice summary of what each family member qualifies for and a high-level overview of what those subsidies are. So you will have explanations around the Silver Enhanced Savings, health insurance plans through Colorado Connect, and if they had any other options, it would be displayed here as well. And if you or a family member actually do have lawful immigration status, you may qualify for different coverages. And you would be able to click this Learn More, which would take you to a separate tab to look further through those options through Connect for Health Colorado. All right. So now we are beginning the shopping part of the application. So the very first question we always ask once we begin the shopping is, if anyone uses tobacco products, we're going to select no for each of these individuals here. Continue on to the grouping household members. So you can edit groups through this grouping household members. So you'd be able to create different medical groupings if you had the options to do so. One thing I do want to show here, I'm not actually going to drag and drop all of these individuals. I'm just going to save to show if you properly did group correctly, you will see a success message. If you did not correctly do your groupings or medical groupings, it will throw an error. And so that's just something I do want to call out. You can't just kind of try to group people in any way you think is possible. There is a lot of different variables that can change up the groupings. All right, so now we dive into the actual shopping for health insurance plans. Right now, I'm just sharing one option and what that will look like, just because we want to focus on the information here. Majority of the time, you will see way more plans than just one. If there are more than one plan, you always have the option to compare different plans against each other. But on this screen, it provides the high-level information on a lot of the terminology that was discussed previously. So it talks about the deductibles of individuals, family deductibles, out-of-pocket maxes for individuals and families. You have the primary care co-insurances for specialist urgent care. And it provides the most important information on what you will pay. And what you will pay is $0, but we do still show the monthly premium on what it would have costed without those Silver Enhanced Savings. So with this, we're going to go into plain details here. If you wanted to get additional information around the plan that you are looking at to select, you can see it all here. And get way more details around mental health benefits, emergency care, maternity, prescription drugs, so on and so forth within this screen. So with that, I'm going to go ahead to select this plan. And we are already close to the end of the application. So here is the plan you selected and what it will cost. It's just repetitive information, just confirming on what health insurance plan you have selected and what you will pay for. Once again, $0, and we still show the monthly premium and what it would have cost, being that $613. Going to click continue. And with it being $0, you still will see this first month's payment page. I will clarify that we are currently doing research around these payment screens. We understand it is not intuitive for a $0 premium to still go through payment screens. So we totally understand the pain points here, but I will walk through this to help explain what the process will be with those $0 premiums in these payment screens. All right, so you are going to click Make Payment, and you will see one option on how you can make a payment, and it is mail, check, or money order. When you select this, it will provide some additional information, which says, please do not send a check until you receive a bill from Friday Health Plans. The biggest thing here is your premium is $0. You should not be receiving a bill from Friday Health Plans if you enroll in a $0 premium plan. And then the last message here is you must submit full payment in order for your coverage to begin. Once again, I just want to reiterate, with a $0 premium, you should not be receiving a bill for premiums with the health insurance plans you select through the Silver Enhanced Savings. So we totally understand it's a little confusing, but this messaging here should hopefully clear up some of that confusion going through these payment screens. All right, so once I confirm the payment, you can see the Make Payment is now grayed out because you don't have to go through that process again. And we are going to continue on to the couple final pages here. So the enrollment agreements, this is all kind of the legalese of actually agreeing to what you have selected health insurance wise. You definitely have to check the terms of use and privacy policy and then provide your electronic signature again at the very end here to continue. The continue button is grayed out here just because I can't type within this prototype. But if I typed in Bob Jones, this continue button would activate and you would get this final what's next messaging. So this gives you information around allowing 72 hours for your insurance company to receive your enrollment information. It won't be instantaneously when you enroll through Colorado Connect and communicating to that insurance company. But this gives you some additional context on what these next couple of days and notifications and information that will get sent to everyone via the insurance company. So when you click OK here, it will take you back to the welcome page and you should see your plan that you enrolled in. So you can see it's the Friday Health Plan. The premium is $0. And the last thing I do want to call out here is if they have any issues around their health insurance or want to cancel or terminate their plans, we do have this informational messaging here and a phone number provided for them to be able to contact our service center. And that is the gist of the Colorado Connect prototype. Thank you for letting me do this demo. I hope it was easy enough for everyone to understand, and I'm excited for November 1st for this upcoming open enrollment with this. So I'm going to go ahead and stop sharing.
Thank you so much, Jeff. We appreciate it.
No problem.
So that was a lot. The application, there's a lot of questions. It is in English. So we really, really want people to understand that there is free help available. So if somebody isn't quite sure, do I qualify with my income? What is this program? Maybe there's a family with mixed documentation status, right? Mom is undocumented, dad is a DACA recipient, the kids have residency status. What happens to that family? Our experts are going to be able to get everybody in that family into the proper situation. They will walk through the application step by step, make sure everybody understands what is being asked and the information being provided. And again, this is confidential, free expert help available statewide. We have several different languages. And in addition to all of the different languages our experts speak, they all have access to an interpretation line as well. So you can see we have folks all across the state. They all take in-person appointments or virtual appointments if it's more convenient for somebody to use Zoom, and they are all trained and certified by us. So Miriam has been dropping those links into the chat, so you can take a look at our experts who speak other languages, and hopefully everybody will really take advantage of this resource. It is so critically important that everybody understands what they're signing up for, how to use the health insurance, because that is the point of health insurance, right? Is to be able to actually see a doctor.
Awesome. And then from here, we are going to be answering some of your guys' eligibility questions or any other questions that you had around what we presented today. Please take yourselves off mute. If you want, you can also drop them in the chat so we can answer any questions or points of confusion. And I think to restate what Jesselyn said, there's a lot of information that we went over. And we want to make sure to understand what it is that is confusing or where we can provide a little bit more clarity and or support for our communities once the enrollment process starts. And I think there's already some questions. Awesome. So, and Jesselyn, I'll just, if you want, I can just read them to you and you can just answer them if that works for you. I may have missed this, but will the service of the brokers be free or is there a cost?
Great question. It is a free service and there's no obligation. So if you talk to one of our experts and maybe somebody decides this isn't right for me, you know, just by talking to somebody, you're not signed up for anything, there's no obligation. There is no harm in talking to one of our experts to see how they can help you.
Thank you, Jesselyn. And then the next one is, will you be sending out the PowerPoint? Yes, we will be sending out the PowerPoint and the recording. And because Jesselyn and Jeff are so kind, we will have a repeat of this presentation November 16th. And then on October 27th, we're going to have a presentation, CCHI and CIRC, on how the Colorado option insurance works. From there, we go to Jose, who's asking, so the web form does not have the ability to be displayed in Spanish or other languages. And I can answer this for you guys. No, not this year, but I'll throw it back to you guys from Connect for Health because I don't know, I'm speaking for you all.
Yes, so just like Miriam said, the application right now is only in English. We are working really hard and really quickly to change that as soon as we can, but it's not going to happen before November 1st. However, all of the web pages explaining what the program is and how to find expert help is available in other languages. So it's coming, which is another reason why it's so important to connect with those experts who can speak the language of your heart.
Yeah, thank you, Jesselyn. And I think something that I would also like to add is, enrollment period is from November 1st to January 15th. We recommend that you guys start making appointments as soon as possible, since appointments can fill up before this enrollment time, before the open enrollment starts November 1st. And so the next question, which I have no clue about, if we're being honest, just to clarify, nowhere on the application process does it ask for a social security number.
Yeah, so there is a section for somebody to compute a social security number, and there is a reason for that. There are a few circumstances, and if we could get everybody muted.
I'm sorry, can you repeat that?
We need folks muted, please.
Oh, sorry.
There we go. You're good. So there are a few circumstances where people outside of this community might come through Colorado Connect, and in those circumstances will need their social security number, but it is absolutely not required to enroll in this program. Again, this is why it's really important for somebody to work with an expert, because they'll be able to tell them, you know, yes, no. So a social security number is not required. You saw it on the application because the application is used for a few other circumstances.
Thank you, Jesselyn. And I don't think there's any more questions coming through the chat, but if you guys have any more eligibility questions on who qualifies. Oh, Jose, go ahead. If you want to take yourself off mute, please.
Thank you, Miriam. I do have a comment slash question, and it's about fear that still exists among our community of Hispanics and other people from other countries who are immigrants about the public charge. And I know that I know, and I clarify, I know that this program is exempt from that. But can you go through and explain how and why it's exempt, and how is it that it doesn't punish people under the charge rule?
That is a great question, Jose. So the Biden administration put out updated public charge rules, I believe from 2021. I will try to find that and drop the link in the chat for you. But it was a change made by the Biden administration last year. It is the federal government that sets the rules for what constitutes a public charge or not. So that answers the how. And so not only does the federal government not consider it for public charge, but also we do not give anybody's information to the federal government for them to make that determination anyways.
Yeah, and I think something that I will also add, the subsidies that they would be receiving through the Silver Enhanced Savings are state subsidies, which are also incredibly hard to be made into public charge. There is a resource out there that I'm pretty sure is called My Friend Ben that I can find and send through the chat, where you guys can check on what benefits are thought to be public charge and what benefits are not considered to be public charge. What I will also add is there's a lot of fear in our community on what is a public charge and what isn't a public charge, but for the most part, a lot of the benefits that our undocumented population have access to, including emergency Medicaid, are not public charge. Neither are state subsidies or Medicaid programs. If there is any more question on that, please let us know, and I will find some documents on how to see if you are a public charge or not. But at the end of the day, I will also advise that for certain folks, particularly who have some chronic conditions, to check with your immigration lawyer on not about the Colorado option. The Colorado option is not a public charge, but if there is more fear, your individual immigration case is very unlikely. And I'm trying to reply in the best way I can. We have in other presentations that CCHI has done, we have outlined, and I can send this PowerPoint as well, the other one we did, on what is considered a public charge and what is not. And so the Colorado option does not fall on that. But if you guys have fear on what is considered and what is not, I can send out resources that help you determine whether you're a public charge or not. But without adding more confusion, the Colorado option and OmniSalud and the subsidies are not considered a public charge. And then somebody asked, oh, and Gwendolyn, we'll go to you and then we'll answer the other questions in the chat.
Gracias, Miriam. ¿Me escuchas?
Yes, we can hear you, and I can translate.
Oh, no, I can also say it in English. So this is a question and also a thought that I have. So for those who enter a little bit late, if you don't mind to just put the link where to make the appointment for to just start with their enrollment and save their space, that would be awesome. And my question is, what is CCHI in CIRC or in any other agency doing to ensure or to just make sure that that agencies or organizations that are helping for this enrollment are in no contact with ICE, or actually they are pro-immigrant, 100 or 200%.
Thank you, Gwendolyn. I can answer the last part of that. The orgs that we're working with to make sure to send people to and or to help us spread the word about this are pro-immigrant. We're not working with anyone who's not pro-immigrant on our side from CCHI. And we've had different meetings with them to understand what materials are needed, as well as to assess how they're speaking to community members and what information they're pushing out to folks. And I'll let Jessalyn answer the other part of that question.
Yeah, so our experts who are helping with this enrollment can actually face a lot of consequences should they break that trust or break the agreement to keep people's data safe. They could lose their business, they could be charged criminal penalties, they could be charged fines. So there are a lot of consequences that come with any of our experts inappropriately using anybody's personal information.
Gwendolyn, is there anything else that you feel like we didn't answer, or did we properly address your question?
No, that is great. Thank you so much. And would you mind sharing the link again to for people to just find the place where they can go and enroll, or to start just like signing for enrollment?
Yes, of course, we can drop those for you. And now we go into, thank you, Jessalyn. And now we go to another question. How about dentist coverage? So the Colorado option, like most insurance options, and this is a criticism that I will always have, is we are humans with teeth and eyes, and the fact that this is divided in coverage is absurd to me. But in the Colorado option does not have dental nor eye care included, and this is standard for most plans, as I understand. Another question I got privately was if you have a medical emergency like a surgery, can we apply? And I'm trying to understand.
So I understand where they're going with this. So that is why it's really important to get covered during the open enrollment period. Nothing includes retroactive coverage. So let's say you don't have OmniSalud, you fall down the stairs, you break your arm, you try to enroll the next day, that broken arm will not be covered. So it's really important to get covered during the open enrollment period. But I will also remind folks of emergency Medicaid as a really great resource for those folks who do have an emergency and may be uninsured.
Yes. And then with emergency Medicaid, really quickly, you have 3 months after the emergency to apply for retroactive care. And then do you guys have any other questions at this time? Eligibility questions?
I see one from Patricia in the chat that I want to address real quick.
Yes, go ahead.
The question is there a guide or a directory of providers, services, hospitals, clinics that accept the insurance plan? The answer is yes. So these plans are private health insurance plans by all of the same insurance companies in Colorado. So Kaiser, Anthem Blue Cross Blue Shield, Denver Health, etc. So each insurance company will provide that person the provider directory, what's in network, the hospitals, the clinics, etc. And again, whoever is helping with that enrollment will be able to help you access those provider directories. We'll be able to show you how to look up a doctor, how to look up a hospital, etc. So it really just depends on the insurance company. But yes, there will be provider directories and, hospital directories for each plan. The next part of the question is there a limit on visits or specialists that are not covered by the plan? Again, that's going to be up to each individual insurance company. That's what we call out-of-network coverage, and it's going to look different based on each insurance company. What criteria are there for surgeries, assistance services for people with disabilities, people who are elderly with disabilities, cancer patients, etc.? First and foremost, I want to say that these plans are fully Affordable Care Act compliant, which means that nobody can be denied based on a disability or pre-existing condition. That is very important. The second thing I want to say is that for OmniSalud, there is no age limit. So people who are over 65 are also eligible for this program. And then in terms of the specifics for a surgery or something like home assistance, again, that is going to look a little different based on each insurance company. And those experts who are helping will also be able to answer those types of questions as well. Yes, you heard correctly. This does not include dental or vision. We really, really hope that changes in the future, but for 2023, unfortunately, there is no dental or vision.
And then really quickly, another question that came in that I was actually going to ask you, Jesselyn, just so we have it on record, is for mixed status families. So what happens when a family is mixed? Let's say the kids have Medicaid, but the parents are undocumented.
Yeah, absolutely. So those parents are still eligible to enroll through OmniSalud. We see this a lot with people who are not undocumented, right? Maybe mom and dad come through Connect for Health Colorado, but the kids are still using what we call CHP Plus or CHIP Plus. Those experts are going to be able to help those enrollments. They'll make sure those kiddos stay covered under Medicaid and will help those parents get enrolled through OmniSalud.
Jose, do you want to go?
Yes, thank you, Miriam. So I think I know the answer, but as you mentioned, right, that OmniSalud will not discriminate people with disabilities or any other basis. However, my understanding is that OmniSalud will not cover at all any long-term care services, right? Is that correct?
That is correct. Question here to confirm, there are only 10,000 spots for the insurance. So as many people as necessary can enroll in OmniSalud, but for the financial help that makes it $0 a month, we have 10,000 spots. Once we do not anticipate that we'll fill all 10,000, we certainly hope so. And that's why we need your help spreading the word about this program. If we do hit 10,000, people can enroll, but they will have to pay full price.
Thank you. And I just want to mention that I dropped in the chat a public charge resource that comes in different languages where you can check to see if you are or if you fall under the public charge. But something I'll like to add is most of the folks in Colorado do not fall under the public charge, and this program does not fall under the public charge. The public charge screens whether you can become dependent on basically the federal government to keep you or sustain you. And so that's a resource that you guys can use to screen yourselves on what the public charge is. But once again, the Colorado option and the subsidies are state funds, so it would not qualify under that. And there's another question. Thank you for answering these questions. And just to confirm, another thing, oh wait, you already answered that question about the 10 slots. Thank you, Jesselyn.
No worries. Patricia and I are going back and forth right now. So Patricia also asked, is there a cost estimate, right? Like once the 10,000's filled and somebody has to buy full price, what does that look like? I don't have a great answer for you right now because the state has not published the final premiums of the plans or the final rates of the plans. So we will have a better sense of that in about a week, hopefully, right? We're really close to November 1st. We need to know that really soon. But I can't answer that question until we see those final prices that the insurance companies publish. We just don't have them yet.
Go ahead, Jose.
Sorry, is there a plan to expand or a possibility to expand the 10,000 spots for people who have really low income? Because I imagine, given our experience with, for example, immigrant people who have disabilities, etc., 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 because with this, at least they will get the medical coverage that they don't have right now, right? So is there a possibility or a plan to, if we hit soon or pretty soon the 10,000 spots, expand that using some kind of like bill or something to talk to the joint budget committee? Because I can do that. CCDC can help with that.
Yeah, that's a fantastic question, Jose. So that decision does not lie with Connect for Health Colorado. The funding for those 10,000 slots is governed by a board called the Health Insurance Affordability Board. You may remember this bill, Jose. It passed back in 2020. It was Senate Bill 215, creating the Health Insurance Affordability Enterprise. So the funding is governed by that board. It is overseen by the Division of Insurance. I really recommend taking a look at their webpage, attending the board meetings. There's always opportunity for public comment. And ultimately that decision would come from that board.
I see. So is it not within your power or ability or political ability, I guess, to advocate in a later time for an expansion of this?
That is a great question. I think it is safe to say that if we can demonstrate that we are hitting that 10,000 cap, we would absolutely be eager to see the board raise that. At the end of the day, our mission is to cover as many Coloradans as possible.
Thank you.
Thank you, Jose. And I think, are there any more questions regarding who is eligible or who is not, as well as anything else about this process? I'll also add another question, Jesselyn, for the record, if you can answer it, and then we'll go to Wendelin on, you said that there was no age restrictions. So as we understand, Cover All Coloradans Pass, which is going to be expanding Medicaid coverage for undocumented children and pregnant humans. But let's say that there's an undocumented child now. Will they be able to apply?
Yes.
Thank you. And so there's also no age cap as well. So our elders can also apply.
Correct. This program is really designed to fill in those gaps, and we understand that Medicare is not accessible to every single person in Colorado over 65. So people over 65 can enroll in this. And Jennifer, just want to clarify in the chat, anybody of any income. So if somebody is undocumented or DACA status of any income can enroll through OmniSalud. But to get the financial assistance that makes it $0, they have to be under 150% of the federal poverty level. And like I said, for an individual, it's a little over $20,000 in annual income. For a family of 4, it's a little over $41,000 in annual income. And what I will say is if you feel unsure or somebody you know feel unsure, like, man, maybe I'm right on the edge, I'm not sure if my income qualifies, again, come talk to one of our experts. They're going to be able to help you out with that question.
Thank you so much. Well, please forgive me if this question sounds confusing or a little bit dumb, but what is the data on regards undocumented and qualified for this benefit? And if I heard well, we only have certain spaces for people to enroll, right? Meaning that if I don't enroll from November 1st until January 15th, I miss my chance. Or if we exceed the numbers of enrollments and I try to enroll in that period of time, but I am one of those who procrastinate my appointment, there is a chance that I'm going to not be able to have this benefit, correct?
Yeah, so I had a little bit of a hard time hearing the first part, but I caught the second part. What happens if somebody comes January 16th outside of that open enrollment period? There are certain circumstances where somebody may be able to enroll. For example, if they have a baby, if they get divorced, those types of circumstances may trigger what we call a special enrollment period. I don't want to get too far in the weeds, but there are some circumstances where somebody may be able to enroll outside of open enrollment. But we don't want to push our luck. We really want to push folks to enroll during open enrollment because there is no guarantee that they would be able to enroll outside of that. They would need to have a very specific life event or something like that that would trigger that enrollment. So first and foremost, come through open enrollment. We really want to make sure folks get in before the deadline. There are some circumstances where they can enroll outside of that, but there is no guarantee.
Thank you.
You bet. And if I didn't answer the whole part, please let me know because my audio cut out just a little bit on you.
Oh, no, the first part of the question was on regards of the amount of places that we have for people to enroll, but just the supposition of saying like maybe we have a high demand of enrollments, and then some people will be out of that chance if they procrastinate their appointment.
Yeah. Yeah, absolutely. Again, so important that we get folks in before that deadline. In terms of hitting the maximum, right? Like, you know, within 2 weeks, we see 10,000 enrollments. If we are seeing that trend and we're thinking, oh my goodness, we did not anticipate and enrollments are going like this, you know, we're going to let the community know. We're going to let CCHI know. We're going to let CIRC know. We're going to let our experts know. We'll make sure people are aware that it's trending much higher than we anticipated. So hopefully that will light a fire for people to come in very quickly.
Thank you so much.
Go ahead, Patricia.
Sí, muchas gracias a todos por la información. Buenísima, la verdad que es muy necesaria y muy importante saber bien todos estos detalles. Y casualmente algo que dijeron ustedes que cubriría el 96% de este plan las personas que ganen hasta 1.699. O sea que estamos hablando de un 4% que queda restante, eso sería el copago que tendría que hacer, el deductible, por ejemplo, que tiene que hacer la persona cada vez que va a una institución o a un proveedor. Si nos puedes contar un poquito más de eso. ¿Y qué pasa si la persona cobra más de 1.699? ¿De cuánto sería la prima?
Yeah, great questions. And actually, I'm going to share my screen to answer this question, if you don't mind. There we go. Oh. Can you see the proper screen, Miriam? The snapshot? Excellent. Okay, so to answer your question, you can see here, it's that $0 monthly premium. The individual deductible is $100. That is for the whole year. And then the maximum out of pocket that anybody would have to pay for in-network care over the cost of the year is $1,000. Over here, you can see a snapshot more of the benefits. So preventative care, vaccinations, all $0. Primary care, non-preventative. So let's say you have an ear infection, need to go see the primary care doctor. That is also $0, unlimited. If you need to see a specialist, that is a $40 copay. So there is a cost associated there. However, it does count towards your deductible. Mental health, behavioral health, and substance use needs, you can see that is $0, unlimited. Any services related to pregnancy, $0, unlimited. There is a percentage attached to lab tests, but again, there is that deductible and max out of pocket to help protect. And then you can see the cost of the various prescription drugs. If you're not familiar with prescription drug tiers, usually, tier 1 sort of your lowest cost drugs, tier 5 being your most expensive drugs. So hopefully that clarifies a little bit what the actual benefit looks like. Now, for folks who are over income, again, we don't know what the monthly premium looks like to pay full price. We have to wait on those insurance rates to come out. But the benefit definitely looks a lot different. I can show that. So folks who are paying full price, you can see it's a higher deductible, it's a higher out-of-pocket maximum. Again, I will point out that folks can use emergency Medicaid in combination with this when there's an emergency. But you can see that for these plans, for folks who are paying full price, there are still $0 and low cost benefits. Again, the preventative care, the vaccinations, primary care, mental health, this is huge, $0 unlimited, the pregnancy, and then you can see the prescription drug tiers as well. So hopefully that helps you understand a little bit what the benefit actually looks like. This is, of course, not the full explanation of benefits, but a very good snapshot.
Claro que sí, muchísimas gracias, Desalín, esto ayuda muchísimo. No veo nada, perdón, referente a los estudios de alta complejidad. ¿Hay algo que tienen paralelo también como este cuadro?
I am happy to make sure that these two images get to Miriam to send out in the follow-up. Does that work?
Hey, Patricia, you were talking about some studies that you don't see anything for. Can you repeat that?
Claro, estudios de alta complejidad, una TAC, una resonancia magnética, un SPEC, todos estos estudios de alta complejidad.
Okay, alta complejidad. So,
Colonoscopía, que es lo que la mayoría no
Okay.
cubren y es cara.
awesome. I guess that's a follow-up for you, Jesselyn, with regards to not seeing high intensity tests like colonoscopy. I guess it would just all fall under lab test. or?
I'm not 100% sure, and I don't want to give the wrong information. In this slide, I have linked to the Division of Insurance's regulation. So that would be the best resource to dig in a little bit to see where an MRI or a colonoscopy would fall.
Awesome, thank you. And Wendelin, do you want to go?
I forgot to lower my hand. I'm sorry.
Oh, it's all good. Thank you. That's happened to me plenty of times. And so there's a question about the low payment and folks that have insurance through the employer, Jesselyn. If you want to answer that. Meanwhile, I'll do this other thing.
Yeah, absolutely. People who are offered insurance through their employer are not eligible for this program.
Yes, and something that I really quickly want to point out is we do understand that what we're presenting is very confusing, and we do also understand that a lot of our undocumented community in particular receives their care through federally qualified clinics, and they do amazing work. Our community health clinics should constantly be rewarded for what they do. With that being said, our community clinics don't always offer some of the high intensity care that folks might need. And so one of the things that we're also trying to do is make sure that the community clinics become part of the network of providers for folks that join the Colorado option. And that's something that we are currently working on. But if you are a community clinic interested in becoming part of this plan, as well as have connections with other community clinics, please feel free to email me. We are making sure to send out documents on what it means to sign up to be one of these, and also what are the qualifications that you have to meet. And lastly, I keep dropping in the chat a survey for this presentation, and please, if you guys could take it at some point, here you can ask more questions. You can also tell us what's not clear, because we do understand that there's a lot of confusion since this is really new, and we just really need your feedback to be able to fix what we're not explaining correctly, or to fix those gaps in information that we're pushing out. With that being said, I'll pass it over to you, Jose.
So did I understand correctly that if someone is employed and their insurance through their employer is expensive and it's hard for them to afford it, they cannot apply for OmniSalud?
I'll say that the program is not intended for people who can get insurance through their employer. I will also say we do not ask that information on the application.
That's good to know, because what I'm thinking is there might be some employees who have an insurance available to them, but they may feel like it's too risky to even apply for it because they are working under the table or some other situation, right?
Yeah, I hear you. And one message I do want to share as well is that the health insurance companies have to follow all of the same privacy laws that we do. So just like that, their information is kept safe when they enroll through this program, their information should also be kept safe when enrolling through their employer. That is considered personal health records. That is considered personally identifiable information. And just like we can get into really big criminal trouble if we share that information, so can the insurance companies. Yeah, great questions and comments, Jose. I really appreciate it. I will also, let's move to the next slides. I just want people to see that when the slides are sent out, we have all of those great links also here in addition to the chat. So if you did not grab them, These are the OmniSalud pages and the help page to find an expert. You will also see a link for CCHI's really excellent explainer about what these plans are. And then again, Miriam's survey so that we can better understand what you all want more information about and what's confusing.
Awesome. Thank you, Jesselyn. And yeah, I think at this point, it was going to end at 7:30, but I feel like we can end a little bit early for you all. And please take that survey, ask any questions. And I think the one thing that some folks said they couldn't hear or that I'm getting messages about is if you are part of a community clinic, you can sign up to be a in-network provider for those that under the Colorado option plans. And so there's a one pager that CCHI has created on who qualifies to be a provider and what does that mean in the process of getting that starting that process to become a provider, as well as where you can contact us if the process is not working. With that, you can always email me. Once again, I think I dropped it in the chat if you are interested, but we are going to be sending out an email with all of these resources that we shared tonight, as well as the slides and extra information. And I think at this point, Jesselyn, if you feel comfortable, we can end the night. And thank you guys again for all the information that you've provided through your questions. They're very valuable, as well as just for attending and having a desire to communicate this out to the people that we know need it most. And thank you, Jesselyn, and thank you to Connect for Health for joining us, as well as thank you, CIRC, for hosting. And we will be having another webinar, as we mentioned, next week on the 27th on how to use health insurance. As well as another repeat of this in November 16th. But please push people to the assistance site and find them appointments before November 1st. Thank you, guys.